Viral hepatitis. The term viral hepatitis is used to include two similar diseases caused by separate types of viruses and typically transmitted by different means. These are designated as hepatitis type A and hepatitis type B. 1. Hepatitis type A, previously called infectious hepatitis. This type of hepatitis is more common among children and young adults than in older persons. The virus is usually transmitted by person to person contact, especially among those living under the crowded conditions with poor hygiene. The virus can be transmitted by contaminated food or water. The symptoms of the illness begin from between 2 and 6 weeks after the virus was transmitted to the individual. The onset of symptoms is usually abrupt, and the duration of the illness is about 6 to 8 weeks, shorter than the duration for hepatitis type B. Hepatitis type A is seldom associated with serious complications, there being a mortality rate of only about 0.1%. Hepatitis type A can be prevented, or at least modified, by the administration of immune serum globulin even after contacts have been made with persons ill with the disease. The protection afforded by the use of immune serum globulin lasts up to 6 months. Hepatitis type B, previously called serum hepatitis. Hepatitis type B typically affects young adults, but it may affect older persons also. It seldom affects children. The virus for this type of hepatitis is usually transmitted by accidental injection by some contaminated instrument, such as a hypodermic needle as used in drug abuse, a tattooing needle, the instrument for passing envelopes, or by blood transfusion. The incubation period, time lapse between transmission of the virus and the onset symptoms, is a long period of 4 to 20 weeks. The onset of the symptoms is usually gradual. The duration of the illness is 3 to 4 months. This is a more serious illness than that of hepatitis type A. Serious complications occur in 5 to 10% of cases, and these usually involve serious damage to the liver. The mortality rate for hepatitis type B is between 1 and 10%, usually not exceeding 2%. Hepatitis type B cannot be prevented by the administration of immune serum globulin. However, progress is being made by medical scientists in the development of a protective vaccine. Cause of illness. For both types of viral hepatitis, the cause of the illness may be described as having 3 phases: a prodromal phase, an esoteric phase, and a recovery phase. In the prodromal phase, the individual becomes ill with serious symptoms similar to those of influenza: malaise, loss of appetite, nausea, and fatigue. The prodromal phase is soon followed by the esoteric phase, in which there are evidences of temporary involvement of the liver, with the function of the liver becoming abnormal. This evidence consists of jaundice, yellow coloring of the skin, and whites of the eyes. dark colored urine, and light colored stools. The intensity of the jaundice reaches its maximum in 7 to 14 days and thereafter it subsides progressively. During the phase of recovery, the symptoms and the jaundice gradually disappear. The patient is usually quite comfortable during this phase, but it is important that he not engage in any kind of strenuous activity lest there be a relapse of his illness. What to do? Viral hepatitis should be taken seriously. If the patient is not already under the care of a physician, he should be as soon as the nature of the illness is recognized. During the course of the illness, the physician will arrange for repeated tests of the liver's function. The information provided by these tests will enable the physician to judge the seriousness of this particular case so that he can modify his treatment accordingly. Rest throughout the period of illness is the most important item in the treatment of viral hepatitis. The patient's strength and vitality should be definitely conserved. The patient with viral hepatitis typically has a poor appetite. It is important, however, for adequate nourishment to be maintained throughout the period of his illness. In some cases, it is necessary to supplement his diet by the intravenous feeding of glucose. Surgical procedures during the period of illness with viral hepatitis should be avoided as far as possible. The effect of an anesthetic can be damaging to the liver during this time, when the liver's function is already reduced. The conditions of jaundice usually causes the skin to itch. This itching may be somewhat relieved by the use of frequent alkaline baths or by the application to the skin of calamine lotion. It is important that the patient recovering from viral hepatitis be restrained from consuming his normal activities too soon.